Welcome to our celebration of the accomplishments of our students who are leaving us to fulfill their promise as public health practitioners and researchers. Due to COVID-19, we were unable to fully acknowledge our graduating students through the normal award ceremonies and graduation. In particular, our PhD students and their advisors were denied the honor of participating in the quitting ceremony at graduation. Therefore, we wanted to take this time to recognize the efforts of these students and highlight their incredible accomplishments.
Hi, I'm Pat McGovern, Professor in Environmental Health Sciences and the Academic and Research Co-Advisor to Lieutenant Kate Babcock. I want to congratulate Kate on her success to date with her doctoral studies and dissertation. Kate is on track to defend her dissertation by August 14th, given a need to return to service in the U.S. Navy. Kate is a PhD student in environmental health with supporting coursework in occupational services research and policy and a minor in epidemiology. It has been a real pleasure to serve as Kate's academic and research co-advisor. She's an excellent student, fun to work with, and she brings an adventuresome spirit to life and learning. Before enrolling in the program, Kate had a track record of leadership and management, serving as a lieutenant in the Navy focused on workforce, health protection, public and environmental health, and medical logistics, working at locations throughout the world. As one example of being adventuresome, in the first year of the program, she jumped into a volunteer activity, helping me implement a pilot study of worksite health promotion program for caregivers to the elderly in assisted living communities in rural Minnesota. She later worked with Christy Rosebush to identify their own questions of interest from the existing data set. Together, they analyzed the data and created a poster, Caring for Caregivers, testing the impact of management-driven health interventions on job satisfaction and retention of elder care employees. Their poster was accepted at EPICO 2017 in Scotland. I think a real highlight of both of their skills and successes. Her interest and expertise in occupational health and her personal experience with family members receiving home care led Kate to her dissertation research and her thesis entitled Helping Home Care, Evaluating Workplace Injury Outcomes. Her study was funded by the U.S. Navy, and the data stewards were State Farm Mutual Insurance, a workers' compensation carrier. Support was provided by an excellent committee that included her research co-advisor, Dr. Katie Schofield from the University of Minnesota at Duluth, Dr. Susan Mason from epidemiology, Dr. Patrona Lee from environmental health. In addition, Dr. Brian Dowd from the Division of Health Policy and Management served as an informal mentor. For Kate, I wish best of luck with all your next adventures, and we look forward to hearing from you. Thank you.
Congratulations, Dr. Bustamante. When Gabrielle applied to our occupational environmental epidemiology program, I was really excited to have someone to join us who had an excellent background in public health and also experienced teaching at the university level in Ecuador in public health, as well as broad interest in epidemiology and public health. I was not disappointed, and she made an outstanding student and great contributions to this program. I was fortunate to have Gabriella as a TA for our undergraduate course, Global Public Health and the Environment, for 4 years, where she was not only an excellent TA and a great resource for students, but kept both the students and me on track throughout the semester. Gabriella has demonstrated a remarkable initiative and passion for public health by getting involved with research that went well beyond her dissertation work. She continued to do some important work in Ecuador with colleagues there that evaluated child sexual abuse prevention programs. She wanted to gain laboratory research experience, so she sought out some experience with Irina Stepanov, initially as a volunteer. And this work led to the discovery of one of the first recognitions that e-cigarettes can cause carcinogens to form in the user's saliva. This work was not only published, but also led to 2 awards at the SPH Research Day for Gabriella. For her dissertation project, Gabriella really demonstrated great initiative and ability to think about how the complexities of environmental health determinants of disease. She developed a method to link the nationwide radiologic technologist cohort to census data to address her hypotheses about the relationship between neighborhood socioeconomic status and in combination with occupational ionizing radiation exposure and risk of heart disease. This was a very complex project, and she also demonstrated incredible patience with working with our NCI colleagues. Gabriella was a trainee in the Occupational Environmental Epidemiology program at the Midwest Center for Occupational Health and Safety. She was also the recipient of numerous awards, including the inaugural recipient of the Jack S. Mandel Scholarship, both the Bond and Wright Scholarships, the SPH Dean Scholar Award, and as previously mentioned, 2 awards at the SPH Research Day. It was delightful to have Gabriella as a student in our program, where she contributed to the community in so many ways. I'm incredibly proud of all she has accomplished on her way to becoming a public health scientist, all while starting a family along the way. Gabriella will have a fantastic future ahead of her after her postdoc, and some university somewhere is going to be very lucky to be able to count her as one of their faculty.
Melanie Firestone arrived here 4 years ago as an accomplished public health professional who cut her teeth in the New York City Department of Health. Throughout her time here, she has built on that training and experience to address critical food safety problems and help define how surveillance can improve effective control measures. As she leaves us, she takes her well-honed skills to CDC to work as an EIS officer assigned to the Minnesota Department of Health. Good luck, Melanie.
Congratulations, Ashley. Besides having a strong foundation in public health, one of the things that caught my eye about when Ashley applied to our program was her experience as a junior high teacher. To have held such a position requires commitment, passion for a mission, patience, and desire to make a difference in people's lives. And these are many of the same qualities that make a great career as a public health scientist. These qualities have come through, and I believe Ashley has a real understanding of how the application of public health science can be used to improve the lives of people in many ways. Well, at the University of Minnesota, Ashley took a strong interest in a wide range of issues, including occupational health, pesticide exposure, rural health policy research, and violence prevention. She participated in research relating to the discovery of the cause of disease, describing social inequities in health and how science can influence public policy. Ashley's dissertation research filled an important gap in knowledge that is important to the people of Minnesota. She followed up on some initial evidence from our taconite worker health study that suggested heart disease conveyed a much larger public health burden in the taconite workers than the diseases we initially set out to study, namely mesothelioma and lung cancer. Ultimately, this may not be caused by their work exposures, but emphasize the need to focus on preventing heart disease at the community level. She also followed up on questions related to the role of occupational exposures and chronic obstructive pulmonary disease in the taconite workers as well. Ashley was a trainee in the Occupational Environmental Epidemiology program of the Midwest Center for Occupational Health and Safety. She was also a recipient of the Deniken Fellowship through the Pulmonary Medicine program at the School of Medicine. I'm very excited about the work she will be doing as she enters the consulting world. She'll have an opportunity to examine a wide range of environmental and occupational health concerns, which will aid in the decisions that need to be made, which can be backed up by good science. I'm also sure Ashley will be quite happy to be back in Texas, and having a baby to help start off a new life adventure will only add to the excitement and enjoyment. Congratulations.
My name is Pat McGovern, and I'm a professor in environmental health sciences. And I'm Christy Rosebush's advisor in the doctorate in environmental health. I want to tell you a little bit about Christy and also wish her a big congratulations for her excellent work and dissertation. So Christy focused her studies in occupational health services research and policy. And I consider myself very fortunate to serve as her academic and research co-advisor. She was a joy to work with and has considerable talents, focus, and productivity. For example, Christy co-authored 8 papers in association with 2 part-time jobs with policy-focused teams at the Minneapolis VA healthcare system. Subsequently, she worked with Dr. Joe Gogler and his team on the Families and Long-Term Care Project in the Division of Health Policy and Management at the School of Public Health. Her interest in occupational health and aging studies led to her dissertation research and her thesis entitled Caring for Our Caregivers, an evaluation of the Minnesota Safe Patient Handling Act. Her work was facilitated by an excellent committee, including her research co-advisor, Dr. Katie Schofield from the University of Minnesota at Duluth, and Drs. Darren Erickson from epidemiology and Dr. Marizan Ramirez from environmental health sciences. Christie's study provided a profile of patient handling injuries in Minnesota nursing homes. She also evaluated the effectiveness of the Minnesota Safe Patient Handling Act in reducing workers' compensation claims, an important issue for occupational health and safety. In closing, I want to congratulate Christy again, as her first dissertation paper is published and her second is in press, both in key occupational medicine journals. And I also want to wish Christy the very best in all her future endeavors.
I'm happy to introduce Joe Servario, who started the PhD program with us in 2016. Joe came with a strong background and interest in quantitative methods from his degrees in math and biostatistics. Joe has kept very busy during his time as a student, pursuing further training in epidemiological methods, participating in several projects across a variety of disciplines and groups on campus, seeking opportunities to author several publications and to present at conferences. All of this while staying very much engaged in the student community. I was delighted to know of Joe's interest in infectious diseases, which led us to working together on his dissertation on the topic of yellow fever. He was awarded the doctoral dissertation fellowship to dedicate this past year fully to his research. It has been a pleasure to see his growth as a public health researcher, which I'm sure will continue to produce high-impact work as he continues his career. Congratulations, Joe.
Please join me in congratulating the Environmental Health Sciences class of 2020.